You have 5 minutes. Thank
Thank you, Senators, thank you for the opportunity to speak today. My name is Dr. Sephora Tang. I am a psychiatrist in Ottawa and co-author of the Made to Mad Declaration, an initiative of physicians together with vulnerable Canadians, signed by over 1,000 Canadian physicians who have concerns with the removal of safeguards previously deemed necessary in Bill C-7. Bill C-7 would facilitate the deaths of people whose death wishes may stem not primarily from their comorbid physical illness, but from unaddressed psychological distress. Under the current bill, patients may be approved for medical assistance in dying or MAID without necessitating assurance of access to adequate care, nor requirement to undergo standard medical treatment before receiving MAID. This opens access to MAID to a much larger segment of the population, and the consequence of this reality on vulnerable populations needs to be fully appreciated. The lack of adequate supports is often a direct stressor that triggers suicidal thoughts in an individual. Yet wait times for psychiatric services often exceed the 90-day assessment period allotted by C-7. Without the necessary supports in place to parallel a permissive MAID regime, individuals are left with the prospect of choosing between an assisted death or continuing the uphill struggle of living with inadequate supports. To place an individual in such a predicament is cruel and fundamentally unjust. There will inevitably arise cases where MAID providers will question the appropriateness of administering death as a response to suffering. For the safety of patients and in order to provide appropriate medical care, healthcare professionals must be given freedom to maintain their professional autonomy in declining involvement in requests for death that they deem inappropriate. Under the current legal framework, I may be sanctioned for declining to facilitate my patient's request to end their life. As a psychiatrist, this places me in a precarious predicament as my work in suicide prevention is incompatible with current expectations under the law to facilitate suicide. Despite assertions that Bill C-14 adequately protects the freedom of conscience of physicians to decline participation in MAID, the reality is that physicians in Ontario can now be penalized by their regulating college for declining to participate in arranging and facilitating the deaths of patients, an act that for many is deeply offensive to the integrity of their character, conscience, and medical moral ethics. If the status quo remains, the state is essentially being permitted to compel an unwilling practitioner to engage in an action they believe to be harmful to another person and effectively sets up the conditions for inflicting moral injury upon healthcare professionals. Moral injury is a trauma syndrome that includes psychological, existential, behavioral, and interpersonal issues that emerge following perceived violations of deep moral beliefs. These experiences can lead to feelings including guilt, shame, depression, anxiety, anger, and even self-harm. The provincial parliamentary testimony of Ontario physicians gives evidence to moral distress arising as a result of the effective referral requirement in Ontario. It would be in the best interest of government and society to prevent moral injury in our medical workforce while implementing the provision of MAID services. The recent decision of the Ontario Court of Appeal to uphold the effective referral policy for MAID by Ontario's Medical College amply demonstrates the inadequacies of conscience protection in federal law. The ruling opposes recommendations made by the Canadian and World Medical Associations with respect to upholding freedom of conscience for physicians. Canada has failed on the global stage to demonstrate mutual respect for patients and physicians in this regard. The Federal Criminal Code exists to safeguard and protect Canadians. Amending Bill C-7 to make it an offense to coerce an individual into abating and abetting suicide would send the message that suicide prevention remains an important matter of public safety and would provide an enforceable safeguard to protect patients and physicians from systemic coercion. For the sake of our patients and the health of our medical workforce, I am therefore respectfully appealing to the Canadian Senate to ensure that there are amendments to Bill C-7 that would explicitly safeguard the ability of medical professionals to continue providing care without undue coercion to engaging in life-ending interventions that they find morally and ethically unacceptable. I also urge you to support recommendations that would ensure that all patients have access to good medical, palliative, and mental health care, as well as access to other social supports such as affordable, accessible housing and home supports before pursuing a life-terminating pathway. Thank you for your consideration.